Yep. Well, doctors are urging patients to stay on top of their health, saying that it is safe to go to doctors' offices. We're focusing on prostate health today. The Today Show's Al Roker revealing his battle with this recently. Joining us to talk more about it is Dr. Joseph Wagner. He specializes in urologic oncology with the Hartford Healthcare Medical Group. Doctor, welcome.
Thank you for having me, Lisa.
Thank you for being here. So what are the statistics on prostate cancer?
Well, prostate cancer remains the most common cancer among American men behind skin cancer. Roughly 1 in 9 men will develop prostate cancer in their lifetimes. So this year we anticipate 192,000 cases. It's also important to note that men that are at particular risk are African American and men with a family history of prostate cancer, and that's first-degree relatives, either a son, a brother, or a father. And even though it's so common, deaths are a little less common, but still it's the second leading cause of death in American men. About 33,000 men will die of prostate cancer this year.
Wow, I didn't know that. All right, what are the signs and symptoms of prostate cancer?
Unfortunately, prostate cancer is a lot like high blood pressure. There's not very much in the way of symptoms. Some men might get some urinary frequency, urgency, slowing of their stream, maybe even a little blood. But that's usually in advanced cases, and those exact same symptoms are what happen to men as their prostates get bigger as they get older. So unfortunately, most men with prostate cancer really don't have any signs or symptoms.
All right, let's talk about treatments that are available and effective.
Yeah, so there are a lot of treatments available, and those treatments depend on the cancer's severity. So that can range from no treatment at all. We just simply monitor the cancers for less aggressive cases. When men have localized cases of prostate cancer, like Mr. Roker, they're candidates for surgery or radiation. And for more advanced cases, it's usually chemotherapy or something that what we call androgen deprivation therapy, which are injections to lower a man's testosterone.
All right, let's talk about screening. What is the method for screening and who should be tested?
Yeah, so we're very fortunate to have good screening modalities for prostate cancer. The first is PSA, which stands for prostate-specific antigen. It's a simple blood test. And we also couple this with a digital rectal examination. So that's a finger in the rectum to feel for any lumps or bumps on the prostate. And since we started these screening practices in roughly 1993, we've seen the prostate cancer death rates drop by about half in the United States.
All right, good screening. All right, you're having a virtual education session on the topic of advancing technology in prostate cancer, we should say, tomorrow at 6:30, hartfordhealthcare.org/virtual classes to register. Dr. Joseph Wagner, thank you so much for being with us.
Thanks for having me.